Up to 60,000 COVID-19 tests are processed daily, but lab techs are responsible for far more than those tests. They say one of the biggest demands amid the third wave is coming from the record number of ICU admissions. For more on this, we're joined by CityNews reporter Erica Natividad. Erica, good morning to you. Let's start first with what you're hearing.
Good morning, Faiza. Well, yes, there's a lot of pressure on Ontario's medical labs right now, and they say they're really reaching their breaking point. Now, we know that labs process far more than just the COVID-19 test. They do many types of tests regularly. The pandemic has put a massive workload on top of the regular tests that they do. But they say that this third wave in particular is really difficult because of the record number of ICU admissions. Now, I spoke to the head of the Lab Professionals Association in Ontario, and she says what a lot of people may not realize is that with every ICU patient, doctors will order multiple tests a day in order to monitor how those patients are doing. They may order blood work multiple times a day, and you can imagine with ICU admissions now at 600 plus, with each of those patients, that's that much more workload, and the workforce hasn't actually increased significantly over the past year, so it is quite difficult on them. Here's more from Michelle Hode, the CEO of the Medical Laboratory Professionals Association of Ontario.
Are you concerned there may be a breaking point or burnout with staff?
Absolutely. Absolutely. We're actually working on a proposal right now to bring to the government to talk about how do we expand capacity from a human health resource perspective. So that means, do we look at expanding more seats in our schools? Do we look at more clinical placements in our hospitals? We need a solution because this is not the first pandemic. Viruses change.
And Faiza, as you've been reporting all morning, we're really in the thick of this third wave right now, so the workload isn't going to get any easier from here. So there really does need to be a long-term solution. A lot of these lab techs were reporting feelings of burnout even before this third wave began. So right now they're just keeping their heads down and working really hard, and we got to thank them very much for what they're doing, Faiza.
Erica, speaking of the viruses changing, we know labs are also responsible for screening for variants. So did Michelle speak about that at all and how that impacts the workload in the labs across the province?
She did actually, and you know, that's the other thing that's putting even more pressure on these labs in this third wave. So it's two things here. It's the ICU admissions and it's screening for those variants of concern. So with every positive COVID-19 test that they get, obviously those results are released immediately, but then afterwards they're doing different tests to screen for a variant, and then they're doing genome sequencing. You know, they've gotten more equipment to help them do this as the pandemic, has progressed over the past year, but that's obviously a lot of workload on them as well. Now, tonight on City News, we're going to speak to a lab tech who can give us some firsthand perspective of what it's like in these labs right now. And I also want to mention, Faiza, it is a National Med Lab Week, so we do, of course, want to say thank you to all of those lab techs who are working so hard during this pandemic. They're really critical. They are frontline workers, and they play such a critical role, so thank you to all of them.
All right, Erica Natividad, thank you so much. And yes, so much love to all the lab professionals out there who have been working tirelessly around the clock. Erica, thank you so much. We'll catch this story tonight on City News at 5 and 6.
Thanks.
Stephanie Henry, let us know what's going on in the roads. Good morning to you.